Aspirin, also known as acetylsalicylic acid, is a medication commonly used for its analgesic pain-relieving, anti-inflammatory, and antipyretic fever-reducing properties. Here's a brief overview of its pharmacology. Mechanism of action. Aspirin works by inhibiting the enzyme cyclooxygenase COX, specifically COX1 and COX2. These enzymes are involved in the production of prostaglandins, which play a role in pain, inflammation, and fever. By inhibiting COX, aspirin reduces the production of prostaglandins, leading to its therapeutic effects. Analgesic pain relief effect. Aspirin helps relieve pain by reducing inflammation and blocking pain signals in the peripheral nervous system. Anti-inflammatory effect. Aspirin's anti-inflammatory action is beneficial in conditions where inflammation is a contributing factor, such as arthritis. Antipyretic fever reduction effect. Aspirin can lower fever by influencing the hypothalamus in the brain, which regulates body temperature. Antiplatelet effect. Aspirin also has antiplatelet properties, which means it can reduce the risk of blood clot formation. It does this by inhibiting platelets from aggregating, which is useful in preventing conditions like heart attacks and strokes. Pharmacokinetics. Aspirin is absorbed in the stomach and small intestine and then metabolized in the liver. It has a relatively short half-life in the body. It can be taken orally and is available in various forms, including tablets and capsules. Aspirin has well-known antiplatelet effects, which means it can help prevent the formation of blood clots. Here's how aspirin works as an antiplatelet agent. Inhibition of platelet aggregation. Platelets are small blood cells that play a crucial role in blood clotting hemostasis. When blood vessels are injured, platelets adhere to the site of injury and aggregates stick together to form a plug that stops bleeding. This process is essential for wound healing, but can also lead to harmful blood clots in certain situations. Reduction of thromboxane. Aspirin inhibits the enzyme cyclooxygenase COX, specifically COX1, which is involved in the production of thromboxane A2. Thromboxane A2 is a substance that promotes platelet aggregation and vasoconstriction, narrowing of blood vessels. By blocking COX1, aspirin reduces the production of thromboxane A2. Prolongation of bleeding time. Aspirin's antiplatelet effect results in a decreased ability of platelets to stick together and form clots. This prolongs the time it takes for blood to clot, which can be beneficial in preventing unwanted clot formation in blood vessels. Reduced risk of cardiovascular events. Aspirin is often prescribed to individuals at risk of cardiovascular events, such as heart attacks and strokes. By inhibiting platelet aggregation, aspirin can help prevent the formation of blood clots in the coronary arteries leading to heart attacks and cerebral arteries leading to strokes. The normal dosage of aspirin can vary depending on the intended use and individual circumstances. Here are some typical dosages for common uses of aspirin in adults. For pain relief and fever reduction, the usual dose for mild to moderate pain and fever in adults is 325 to 650 milligrams MD every 4 to 6 hours as needed. It's important not to exceed the maximum daily dose recommended on the medication packaging, which is typically up to 4,000 milligrams per day. For antiplatelet cardiovascular use, low-dose aspirin, often in the form of 81 milligram tablets, is commonly used for cardiovascular prevention. The typical dose for this purpose is 81 milligrams per day, as recommended by a healthcare provider. For inflammatory conditions, the dosage for addressing inflammation, such as in arthritis, is often similar to the dosage used for pain relief and fever reduction. Typical doses can range from 325 milligrams to 650 milligrams every 4 to 6 hours, as needed, with the maximum daily dose not exceeding 4,000 milligrams. Aspirin, like any medication, can have side effects. Common side effects of aspirin use include gastrointestinal irritation. Aspirin can irritate the lining of the stomach and intestines, leading to symptoms such as heartburn, stomach pain, nausea, or indigestion. This irritation can sometimes result in gastric ulcers or bleeding, especially with long-term, high-dose use. Gastrointestinal bleeding. In some cases, aspirin can lead to gastrointestinal bleeding, which may manifest as black, tarry stools, or vomiting of blood. This is a more serious side effect and requires immediate medical attention. Increased bleeding risk. Aspirin's antiplatelet effects can increase the risk of bleeding, particularly when taken at higher doses or in combination with other medications that affect blood. Clotting. This can lead to easy bruising or prolonged bleeding after injury. Allergic reactions. Some individuals may be allergic to aspirin and can experience symptoms such as hives, itching, swelling, or difficulty breathing. Severe allergic reactions are rare but can be life-threatening. Kidney function changes long-term. High-dose aspirin use may affect kidney function in some individuals. Liver function changes. Prolonged use of aspirin, especially in high doses, may affect liver function, although this is less common. Aspirin can increase the risk of bleeding when combined with other blood-thinning medications like warfarin, clopidogrel, or newer anticoagulants. Combining aspirin with other NSAIDs like ibuprofen or naproxen can heighten the risk of gastrointestinal irritation and bleeding. Aspirin, itself an antiplatelet, can amplify the antiplatelet effects when used with medications like clopidogrel, potentially increasing the risk of bleeding. Aspirin and omeprazole can interact when used together, and it's important to be aware of this interaction.